Welcome all. As CivilNet continues to cover the Armenian Society of Fellows conference here in Dilijan, I am very pleased to be joined by Dr. Mariam Manoukian, a physician at Stanford Healthcare, and also Dr. Jerry Manoukian, an internist at Mountain View. So, Dr. Manoukian, Jerry Manoukian, thank you very much for your time. I really appreciate both of you giving us your time. I wanted to start off by asking about your opinion of the Armenian Society of Fellows' mission statement, which was about taking higher education, research in Armenia to the next level. And obviously there's been a lot of knowledge sharing here. They have been talking about the interdisciplinary angle a lot. This is quite an ambitious goal, though, at the same time. So I'm wondering, first, perhaps, Mariam, if you could answer what you thought when you first saw this concept, the Armenian Society of Fellows, and these aims, which are very ambitious.
They are. I think it's a very, very unique organization, at least for in my career. You know, we've been, as a physician from diaspora, I've been to many Armenian international meetings where as physicians, doctors get together and look into different spheres of medicine in Armenia and try to implement some of our knowledge into Armenian healthcare. This is a different level where you see people from economics, from, robotics, from artificial intelligence, which is extremely relevant for everything. Mm-hmm. And to see these bright people who are trying to connect basically to each other from different, I mean, you see there from Europe to US to Armenia and getting these ambitious projects. I think it's in a sense, very interesting experiment that we will see where it goes. Mm-hmm. And
also, Jerry Manoukian, I want to ask, a lot of people we spoke to here were saying the talent exists in Armenia, and they were speaking about how young people are very motivated and all of this, but what lacks sometimes is resources or various, other things. What I want to ask is, what do you think, let's say, for example, in terms of Armenian healthcare, what needs to be done to equip the next generation of Armenian healthcare professionals? And I mean, what would your observations be about the next generation of Armenian healthcare professionals?
I think that education is a theme that comes up almost universally. We have this notion that the health education, the medical education in Armenia is lacking. In many instances, the education itself is not lacking, but the training is. So the idea of somebody going through medical school or even residency without seeing a lot of patients and treating a lot of patients and being supervised through that process is it's a problem.
So how would you describe the difference in terms of training for, let's say, a young American who's going through the same experience and a young Armenian?
Well, during the second through fourth years of medical school, we were seeing lots of patients. In third and fourth year, we were seeing patients all day long. Learning from them, and in residency, we talk almost about overwork of the residents. These postgraduate physicians who are now seeing patients all day long, sometimes all night long.
It's grueling in the United States, as I understood.
Well, it's grueling, but at least we see a lot of patients, do a lot of procedures, learn a lot of things.
And I suppose you can see the difference in a student or young resident who has gone through that process as opposed to one who hasn't as much.
Well, certainly the knowledge base. I mean, I've done training in Armenia and I've done training in the United States, and There is a very big difference, certainly. It's sometimes unnecessarily grueling in US, like you mentioned. But at the same time, the knowledge base is totally different, the way the physician is prepared. Now, having said that, we have phenomenal physicians in Armenia because a lot of medicine is practice also. And the sharing experience with the Armenian physicians and European and US physicians, I think that in specialty care particularly, there is a very big progress in Armenia. In regards to the base, again, the primary care, how in general the healthcare is approached, how it should be more preventative, more proactive versus reactive. I think that and it's new to US too, in a sense. That's where the last 10 years is, let's take care of these people. Let's make them stop smoking. Let's make them eat healthy. Let's do this. Something that is definitely lacking here. We still have to, change.
That also pertains to like public health policies.
Absolutely, and we have big progress. See, there is no one smoking in the cafes.
Yeah,
right. Wasn't that was a massive change? And so I think that the progress is obvious, and for our role here is also very interesting to see in things like this and how we can, work together. Certainly, we want very much to help. There are a lot of doctors from outside who want to come. There are physicians who are coming and staying in Armenia now. We never had that before.
And just to be clear, and also I apologize if I get the lexicon wrong, but when we speak about this primary care versus specialty care dichotomy in Armenia, for our average watcher, what are we talking about when healthcare professionals are speaking about this? Is this a positive thing? Is this a negative thing? What does it mean, really?
What it means is primary care is that you are dedicated a population, a certain number of patients that you're taking care of, and you're taking care of the high blood pressure, for instance. We call it a silent killer. People do not pay attention to high blood pressure in many places, including sometimes US too, but it's a very simple thing. You treat high blood pressure, you will prevent so many strokes. In Armenia, we have a very high-level stroke treatment now, which is great, but hey, let's prevent those strokes.
And the treatment of hypertension, high blood pressure, is typically done by the family physician or the internal medicine, the primary care physician. It's not referred to a cardiologist. Oh, you have high blood pressure, go see a cardiologist.
I see.
Diabetes is similar. The family physician will start the patient on treatment and manage it, as opposed to sending to an endocrinologist.
Yeah, and I mean, what's the state of primary care like in Armenia then? Because as I understood, it's very much more geared to specialty care, if I'm correct about that. Well, what does that?
It's in its infancy.
Infancy, exactly.
Yeah.
It's a lot of things have been done, are in process. So hopefully, we have a conference coming up on it. So, yeah.
We have a conference next week.
There is a conference next week, so please come.
Please tell us about the conference.
It's
So there's a group in Armenia that since 2003 has been doing conferences every 4 years, and these are alternating with conferences put out in the diaspora by the Armenian Medical International Committee. So every 4 years there will be a conference in one or the other place. So they're staggered by 2 years. So the next one here in Yerevan is going to be next week.
It's going to be next week, okay.
July 6, 7, 8.
Perfect, okay, that's interesting. And I want to ask both of you a question in terms of what one policy would you recommend or want to see enacted in terms of Armenian healthcare? Not something I want to help or I want this done, but a concrete policy that you would like to see enacted that hasn't appeared yet?
I think that, in my opinion, it would be the strengthening of the primary care and taking care of the population, is the role of the primary care. And again, it's happening, it's just not there yet. But I think that having a strong primary health care, and I know that Armenian government is working on health care for all, I think that is extremely important. So those two are, I think it's a sign of a country getting into a different level of its development.
Yeah, because in the UK, I'm so used to general practitioners and this whole thing of primary care. You go first to your primary care specialist and then to the specialty.
I would say for my recommendation for a policy would be to take this ASOF mission statement of taking education to the next level. I would say take our medical cooperation to the next level.
Okay.
And we have cooperation between diaspora and Armenia and Artsakh Armenian physicians. But ASOF has, for example, interactions and collaboration between sciences, arts, humanities, economic. When we treat disease in Armenia, it's not just collaboration between physicians or healthcare providers. It is essentially collaboration between the healthcare practice and all the other bills that the patient has to pay. So if I say, here, take this insulin, and they've got to decide whether to buy insulin or buy food or pay electrical bills, then it becomes a sociologic problem. And that's something that, for me as a physician, for me as even a pre-medical student, I didn't get a lot of that. So I'm kind of experiencing that for the first time.
Okay. Also, Dr. Mariam Manoukian, I also want to ask, what is IACS?
EACT.
EACS.
Oh, EACS.
EACS.
Oh, how do you remember that?
Can you explain that to our watchers? What exactly that?
It's actually education of Armenian children through sports. Oh, I'm so
Okay.
excited that you know about it. It is an organization that is formed in U.S. after the war, after a war, 2020 war, where it was obvious to us that a lot of the teamwork was completely lacking, and the soldiers who were killed in the war were looking extremely young. And physical and health, which is extremely, we have so much attention we pay in US, like, the sports is, well, you're from England, but I don't know how it is there, but in US, every child is going through incredible amount of opportunities to be in sports, to play in sports in school and outside. And something that after Soviet Union fell apart, all the attention came to FAST and STEM and all the, FAST is a difference, to STEM programs and robotics and engineering, and suddenly the physical health was forgotten. And I think that we want to bring it back, so creating team sports as a way of teaching children about their health, about how to play together, how to lose, how to, who is the leader, what are the rules, and that's the EACTS. That's right now we're working with the Goals organization, which pretty much a lot of people know. It's an excellent organization of girls' leadership in sports. And we started basketball leagues in different areas in Armenia. So through sports to develop Armenian children. That's what education of Armenian children through sports is.
Okay, that's a really cool concept. Sorry about the pronunciation.
No, you did great.
EACS,
But it's also a concept of I succeed if we all succeed.
Yeah, which is kind of what we're talking about here at the Armenian Society of Fellows. Okay, well, Mariam Manoukian, Jerry Manoukian, really appreciate it. Thank you very much for your time.
Oh, thank you so much.
And thank you for joining us on CivilNet.